what is the ideal or good endometrial thickness for successful pregnancy. So endometrium is the lining of the uterus which is present inside of the uterus. This endometrium has 3 layers: basal layer, intermediate layer and the superficial layer. Every menstrual cycle, when you have bleeding, the superficial layers will shed off, and again the endometrial layer will start reforming from the basal layer in the next menstrual cycle. So every cycle, every day of your cycle will have different endometrial thickness. So endometrial thickness which is ideal is measured just before ovulation or around ovulation, and good endometrial thickness is between 8 millimeters to 12 millimeters. Anything which is less than 8 millimeters can be considered on the lower side, but majority of the studies would suggest 6 millimeters or 7 millimeter as thin endometrium, and endometrium which is more than 15 millimeters is usually considered as thick endometrium. Now let us see why the endometrium can be thin. So endometrium can be thin because of the deficiency of the hormone estrogen in the body. In that case, the supplementation of estrogen may help, but depends upon what kind of fertility treatment you're undergoing and what stage of the treatment you are on. Your doctor will decide the best option. So if it is related to the hormone levels or estrogen levels, supplementation of estrogen will help. Also, there are adjuvant treatments like some amino acid supplements, some vasodilators which can be given orally or vaginally to improve the blood flow of the uterus and the thickness of the endometrium. Now coming to why endometrium can be thin despite of good hormone levels. So if the estrogen levels are good, like above 200, and despite of that, if the endometrial layer is thin, then there might be issues with the lining of the uterus. These issues can be related to some infections, previous surgeries, miscarriages, and such things. So infections, if it has affected the basal layer of the lining, it may cause thin endometrium. Some procedures like DNC or miscarriages can also lead to infections and damage to the layer of the endometrium. Sometimes endometrium can be thin if there are adhesions inside the uterus, which means the wall of the uterus are stuck to each other. Adhesions can happen post-infection, post-procedures like DNC or even surgeries related to ectopic pregnancy or any pelvic surgeries where there is manipulation of the uterus. So the endometrium can be thin because of the adhesions, which we call it as Asherman syndrome. There are different grades of Asherman syndrome, and the treatment varies based on the what grade of the Asherman syndrome or adhesions are present. Usually Asherman syndrome or adhesions require hysteroscopy along with the separation of the adhesions and some form of endometrial rejuvenation therapy like PRP or growth factors to make the endometrium basal layer stimulate and regrow. So there are various treatment options based on why the endometrium is thin. We also have to find out the reason for thin endometrium. So for that purpose, we may send endometrial biopsy for testing to rule out endometrial tuberculosis. Tuberculosis is very common in India, and if we have not treated the infection, the endometrial layer may not regenerate properly. So if the TB is detected in the layer of the uterus or endometrium, then the patient is advised to complete anti-tuberculous treatment and then follow up for the fertility. This was about thin endometrium. Now coming to the thick endometrium. So endometrium which is above 15 mm is called thick endometrium, which may happen because of multiple reasons. There can be the endometrial tissue which is hypersensitive to the hormones. Most of the PCO patients may have this hypersensitive endometrium where the endometrial layer grows too thick. It can lead to polypoidal endometrium, or sometimes there can be polyp inside the endometrial cavity which is making it look like a thick endometrium. So if any issues with the thickness of the endometrium, sometimes hysteroscopy will help in ruling out polypoidal endometrium or even the polyp, and also hysteroscopic polypectomy will take care of the polyp. So thick endometrium usually can be treated with suppression of body hormones, what we call downregulation, and then followed by preparing the lining of the uterus. So this is about thick and thin endometrium. Now coming to the other aspects. So endometrial thickness is not the only aspect which we see, but as a fertility specialist, we also look at the pattern of the endometrium. Before ovulation, usually a nice triple layer pattern says many things about the hormones and also tells me about the chances of implantation. A good triple layer pattern, which means it's good endometrium, which is receptive and may have higher chances of implantation. After the ovulation, this endometrium then becomes compact or homogeneous. So compact or homogeneous endometrium is common after ovulation. Patients need not worry that there is no triple layer pattern after ovulation, because it is supposed to undergo the changes, which means with the effect of progesterone, your endometrium is now compacted and ready to receive the pregnancy. So this was about the pattern of the endometrium. So after thickness and pattern, what other things we check is vascularity of the endometrium. How is the blood flow to the endometrial layer? So there are different grades of vascularity which we check on the transvaginal ultrasound. Good vascularity is up to the layer of the endometrium, which is considered as grade 4 vascularity, and very poor vascularity is only till the myometrium, where the vessels are not reaching till the endometrium. Now the fourth important thing is also PI or pulsatility index of the uterine arteries, which we check on ultrasound. So pattern, thickness, vascularity, pulsatility index, and also sometimes what we observe is endometrial waves on ultrasound. All of these things we evaluate when we are planning for embryo transfer, and each and everything has a specific significance. If your fertility specialist mentions any of those things, then there are treatments to take care of those things before we plan the embryo transfer. I hope this was helpful.